Good morning, everyone. Welcome to yet another episode of Tooth Teacher Tuesday. I am your host, Tim the Toolman Taylor. Just kidding. Different show, much better show. If anybody gets that reference, you deserve a medal. But no, I am your host, Dr. Steven Zom, and today is our inaugural first episode of Tooth Teacher Tuesday, focused on our new segment, Oral Pathology Corner, which, as the name might suggest, is just talking about different things aside from teeth, other things that can go on in your mouth that some are normal, some are not normal. And so I'm going to kind of help you navigate and sort through so that you know the difference. Hopefully put some fears at rest. So for this first episode of Oral Path Corner, we are going to be talking about tori. Tori is just our fancy dental term for essentially little bony nodules or bumps that occur along the jaws. Typically, most common places are either under the tongue or on the roof of your mouth, or sometimes even out on your gums, kind of between your gums and your cheeks. So tori, they're really not a big deal. They're, like I said, just bony nodules, kind of just an anatomical variation. Some people have them, some people don't. They look something like this. Or they can look even more extensive and significant like this. And so, since they're bone, they're really not anything to worry about. Like I said, some people get them, some people don't. I have some myself that are relatively small, but it's just areas where the bone's a little bit denser and forms those little nodules. So it's not any kind of tumor or anything to be concerned about. Really, the only time those tori are a problem is if either A, you're a person who's having their teeth removed and having dentures made, because as you can imagine, if somebody's mouth looks like this, it's going to be hard to make a denture that can sit on their gums because the bone doesn't leave any room for them. So in those situations, we typically, when the teeth are removed, also surgically cut out those nodules of bone to get a nice solid ridge to make the dentures on. Only other problem that those tori can sometimes cause is that they, because they can take up significant amount of room, like in this photo, they can sometimes limit the amount of space in your mouth. They can cause airway issues. So sometimes they, not the only cause by any means, but can contribute to some sleep apnea situations, stuff like that. But that's really all there is to tori. Again, just little extra bone, more of you to love, so to speak. But nothing concerning at all. But it's something we get asked about a lot. A lot of people will have them for years, and then all of a sudden their tongue just happens to notice them, and then I'll have patients called in, hey, I got this bump and I'm worried that I might have like an abscess or something. And sure enough, it's just tori and nothing to be worried about. So if you notice those yourself, obviously when in doubt, by all means, make sure you check with your dental professional to make sure that's all they are. But chances are that's what's going on. It's just some tori there and it's nothing to worry about. So thank you for tuning in to this week's Tooth Teacher Tuesday. We will return to our regularly scheduled program next week. But until then, Heidi ho, good neighbors.